In this procedure, you will learn how to irrigate one or both eyes, as ordered by the provider. Before you begin, sanitize your hands. Then, assemble your supplies. Check the expiration date of the solution. Follow medication safety procedures and check the label of the solution 3 times. First, when you remove it from the shelf. Second, after assembling your supplies. And third, right before the medication is administered to the patient. Introduce yourself and confirm the patient's identity by name and date of birth.
Morning, Kiki. How are you?
I'm fine, and you?
Good, good. Could I get your full name and your date of birth?
Kiki Moore, 1124.
Provide the correct education to the patient. Explain the procedure ordered, the provider ordering the procedure, the desired effect, and common side effects.
Dr. Anderson would like to have you have an eye irrigation done today.
What's that?
Answer any questions the patient may have. Use language the patient can understand. Ask the patient if she has any allergies.
That we're just going to use some solution and rinse out your eye just to help it to feel a little bit better.
Okay.
All right, and so before we get started with that, I need to have you lay back for me.
Okay.
Assist the patient into a sitting or supine position, making sure that the head is turned toward the side of the affected eye. This position allows solution to flow away from the unaffected eye, reducing the chance of cross-contamination of the healthy eye. Put on gloves. Place a disposable drape over the patient's neck and shoulder. Place, or have the patient hold, a drainage basin next to the affected eye to receive the solution from the eye. Make sure to place a polyline drape under the basin to prevent the solution from getting on the patient. Moisten a gauze square with solution and cleanse the eyelid and lashes of debris. Start at the inner canthus near the nose and move to the outer canthus farthest from the nose. If you are using a bulb syringe, pour the required volume of room temperature irrigating solution into the sterile basin and draw the solution into the bulb syringe. If an irrigating solution in a pre-packaged dispenser is used, remove the lid. The solution should be room temperature so that it does not irritate the patient's eyes. Separate and hold the patient's eyelids with the index finger and thumb of one hand. With the other hand, place the syringe or dispenser on the bridge of the nose parallel to the eye to steady it. Squeeze the bulb or dispenser, directing the solution toward the lower conjunctiva of the inner canthus. Allow the solution to flow steadily and slowly from the inner to the outer canthus. Do not touch the eye or eyelids with the applicator. Refill the syringe or continue to gently squeeze the prepackaged bottle. Continue the procedure until the amount of solution ordered by the provider has been administered, or until drainage from the eye is clear. Dry the eyelid with sterile gauze, moving from the inner canthus to the outer canthus. Do not use cotton balls because fibers might remain in the eye.
So are you feeling all right?
Feeling fine.
Okay, good. Then I think we're done for today. As long as you're feeling all right, you're free to go.
Okay, thank you.
Thank you. Have a nice day. There we go.
Dispose of the irrigation drainage. Remove your gloves and dispose of them, along with the drape and gauze in the biohazard waste container. Disinfect the work area after putting on a new pair of gloves. Sanitize your hands. Document the procedure in the patient's electronic health record. Include the date and time, the type and amount of solution used, which eye was irrigated, any significant reactions by the patient, and the results.